General practice family medicine is a medical specialty with a defined curriculum and its own research tradition. It is based on a set of values and a specific approach to problems. Our core values and principles are presented in the following.
We promote continuity of doctor-patient relationships as a central organizing principle.
Trust is the cornerstone of human relationships, and therefore also a cornerstone of our work as GPs. To trust someone with your health is not a given thing. Trust has to be earned and is achieved through continuity of care over a period of time. The benefits of trust are unquestionable. Trust and the confidential relationship between our patients and us improve health outcomes and reduce health expenses. So trust should be the foundation of the entire healthcare system.
We provide timely diagnosis and avoid unnecessary tests and overtreatment. Disease prevention and health promotion are integrated into our daily activities.
Unnecessary tests and overtreatment are some of the hardest things to explain to our patients. Sometimes less is more. Too many tests can harm, especially among healthy people. Overtesting can also be misleading. You might be defined as sick or given a diagnosis that does not benefit your health at all. It can also lead to unfair distribution of the health services, as obviously overtesting steals resources from the sick.
We prioritise those whose needs for healthcare are greatest.
As frontline healthcare workers, general practitioners, family doctors have the responsibility to ensure equal access to essential health services. Regardless of the patient's gender, age, color, sexual orientation, or economic situation. People in distress demand answers to diminish the anxiety, no matter the seriousness of the symptoms. We organize our practices to devote the most time and effort to those who are in the greatest need for support and treatment, and we do our best to avoid making healthy people sick.
We practice person-centered medicine, emphasizing dialogue, context, and the best evidence available.
We want to know our patients as persons, not only their diseases. That is the essence of our medical specialty. To understand the patient as a person, we show interest in the individual patient's current life situation, stories, beliefs, worries, and hopes. This helps us to use the best evidence and to recognize the links between social factors or society and sickness, and to deepen our understanding of how life and life events are inscribed in the human body. We help people identify and use their own and their network's resources for the benefit of their health.
We remain committed to education, research, and quality development.
As specialists of general practice, family medicine, we play an important role in the teaching at the undergraduate and postgraduate levels in the universities, in our communities and in clinical practice. We are engaged in our research in general practice, which can benefit our patients and can make us better doctors. We point out that the new scientific knowledge always has to be interpreted in the context of patients' individual needs and implemented in the context of sustainable societal needs.
We recognise that social strain, deprivation, and traumatic experiences increase people's susceptibility to disease, and we speak out on relevant issues.
Respect for human dignity and human rights is essential for good health and recovery. The burdens of life are unevenly distributed, A variety of conditions can contribute to health inequalities, such as childhood trauma, violence, racism, and gender discrimination. Furthermore, poor housing, lack of education, poor social support, poverty, unemployment, as well as lack of community support and access to healthcare have profound effect on health. It is our duty to speak out in public when factors affect the health or increase inequalities in health outcomes.
We collaborate across professions and disciplines, while also taking care not to blur the lines of responsibility.
General practitioners play an important role in primary health. It's our duty to assist our patients in their communication with other units of the healthcare system and to cooperate with other specialties on an equal basis to provide the best healthcare for our patients. Our goal in this collaboration is to protect the human side of medicine based on sustainable relationships with our patients.